Hi, I'm Dr. Rachel Kennedy at Highland Park Animal Hospital, and today we're going to talk about canine nutrition.
Dr. Kennedy, how do I know what diet is best for my dog?
That's a great question. There is a lot of information circulating right now, so it's hard to kind of cut through the clutter and get to some real facts about food. So biggest thing is life stage, disease condition, and the body condition of your pet. So definitely young, middle-aged, and older pets have different nutritional requirements. And then if your dog has any disease processes, there is specific diet requirements for all of them. So easiest way, if you have a young adult healthy dog, any good quality adult maintenance food, kibble is a very reasonable choice. If you want to do something unique or you are requiring a prescription diet, talk to your veterinarian about your dog's specific needs.
How important is dog nutrition and what aspects of their health does it affect?
Arguably, it's the cornerstone of all health, and we're discovering more and more, especially in people, about how nutrition, gut health, and the like kind of impact all aspects of our health. So arguably, one of the most important things you can do for your dog is provide good quality nutrition, keep them at a healthy body weight, and then adapt their nutrition as their needs change. So very high up there, in my opinion.
Will my dog's nutrition needs change throughout their life?
Yes, definitely. So going from a neonatal, nursing stage to a puppy stage, switching to solid food, definitely different nutritional requirements there. A lot of times it doesn't apply to owners because they're not with the pet yet, but going from puppy to adult food, the biggest thing is puppy nutrition is really high in fat, high in protein. A lot of adult dogs tend to get overweight on puppy foods, so making sure that we're making that switch either when they're spayed or neutered or at about a year of age, especially watching their body condition. A maintenance adult dog food is generally good to use until they have a specific disease process that dictates otherwise, mobility issues, obesity, up until about their senior stage of life, ranging from 8 to 12 depending on the breed, and then switching them over to a senior maintenance food. Generally going to have things that support cognitive health, joint health, heart health, that sort of thing.
What are the signs my dog's nutritional needs are not being met?
Definitely weight fluctuations, weight loss, or weight gain. The other things can be gastrointestinal signs, chronic diarrhea, chronic vomiting, increased thirst and urination, and then poor hair coat, dental health issues. All of that can kind of be linked back to nutrition and can be really helped by it.
Will my dog ever need supplements? If so, when would they need them?
It depends. Most good quality adult dog food is formulated so that you do not need to add anything to it. I generally recommend that large breed dogs start a joint supplement early in life, and then some dogs, it depends on need, dental health need, other things like that. But generally, no. Most adult good quality dog food is all built into one neat little package.
When looking at dog foods, what's the most important information to look for on the bag or can?
Yeah, I sympathize with the buyer right now because you look at a wall of dog food and there's a million choices. Good starting points. AFCO is a regulatory agency that does regulate some nutritional contents in dog food. They should have a labeling on dog food brands that they support. So looking for that. And then most of the time you're going to hear this from most veterinarians, looking at Hill's, Purina, and Royal Canin. These are just tried and true brands that have veterinary nutritional staff. They do a lot of quality control. They issue recalls when it's important. It's just generally going to be a very safe and effective diet, especially when there are so many boutique brands that are just completely unregulated these days.
I've heard that grains are bad for dogs. Is that true?
No, that is not true. There is some pretty solid evidence supporting that grain-free diets have a strong correlation with dilated cardiomyopathy. So we generally do support a complex carbohydrate in dog foods. I think that this is kind of getting conflated with cornmeal byproduct, that sort of things. A lot of times what is happening instead is, instead of having a complex carbohydrate like wheat or barley or something like that, they're using a potato starch, and there is definitely been studies showing that there is a deficit with these dogs. So no, grain-free diets are not recommended by most veterinarians.
Are byproducts in dog foods dangerous?
Byproduct is a very kind of red flag term for a lot of owners. A lot of times all that means is that it is byproduct meal that is not suitable for human consumption but has been qualified to be okay for animal consumption. Generally, if you're looking at a good quality food, this is not filler, this is not dangerous material, it's just the parts of an animal that we don't necessarily want to consume as a person, but has been deemed safe for animal consumption. So not necessarily a huge red flag, although do your research about it and consult your veterinarian, because there's different meanings to different people.
Is a raw diet safe for my dog?
Most of the time we advise against it, and that includes freeze-dried raw. Dogs are not immune to the same reasons that people don't eat raw food, so contraction of infectious diseases, salmonella, the other types of gastrointestinal organisms that can cause GI disease. The other important part, though, is the human handling. So handling this food, you have to be very, very careful with how you're preparing it, washing dog bowls, making sure you're not allowing your pet to lick your children and your elderly grandparents and all of that afterward, because that can be a health concern as well. So most of the time there is not proven benefits, so we advise against it.
Is homemade dog food better than processed?
That's a little bit relative. There is definitely safe and effective ways to do home cooking for your dog. And if you are so inclined, there is resources that can be prescribed to you to do that safely. Generally, though, without any sort of guidance, I'd say kibble or a dog food brand is more safe than home cooking, just because an uneducated owner can cause some nutritional deficits with it.
How do I know if I'm feeding my dog too much or too little?
Generally, you can use weight and stool quality as a pretty good marker for these things. Most of the time, your veterinarian can give you an ideal body condition score and an ideal weight for your dog, and you can generally prescribe a calorie amount and a dog food to go with it to make that happen. And then if your dog is also having chronic GI signs, we might be considering that there's a nutritional need that's not being met there as well.
When would my dog need a prescription diet?
This would be dictated by your dog's condition. So we don't just prescribe a prescription diet proactively, but if your dog is experiencing signs or has been diagnosed with a condition that dictates that they need a specific diet, then your veterinarian will prescribe it for you.
What can I do to prevent dog obesity?
It's just like people. It's obnoxiously simple. Calories in, calories out. So communicating with other people in your household as to not overfeeding the dog, measuring food, having a calorie budget for the day, and then making sure your pet is not overeating, and then give it time and exercise. If you're having really difficulty with it, there's endocrine testing that can be done. Consider looking at your dog's thyroid, that sort of thing. But generally getting with a veterinarian or a veterinary nutritionist can really help you. But it is a frustrating process for a lot of people, and I can say that as the proud owner of a slightly fat lab. So. But yeah, it's frustrating, but it can unfortunately be kind of broken down into a very exact science.
When it comes to treats, do the ingredients or nutritional value matter as much as the food?
Not as much. There is not the same sort of regulations on dog treats as there are in dog foods. Dog foods have to meet specific component percentages, and treats really don't apply to that. Make sure that they don't contain any harmful ingredients, and make sure that they're not contributing to a caloric overload, and you should be fine. I think that's everything for today. If you have any questions, we do a lot of nutrition consultation. It's really important. Like I said, obesity is a really big problem, so getting your dogs lean and healthy through their diet is really important. So give us a call if you have any questions.